Welcome to the second episode of the Cruz Orthodontics podcast. Today, we're going to talk to Dr. Cruz about dental monitoring and how it's going to make your treatment journey even better. Dr. Cruz, can you talk about what dental monitoring is and how it integrates with your practice?
Yeah, sure. Dental monitoring has come up with an ingenious way of remotely tracking patients' orthodontic
Mm.
treatment. They created a device known as the scan box that attaches to a smartphone so that patients are able to sort of scan or take photos of their teeth. More importantly, dental monitoring has come up with software that then analyzes those photos. And this is where things actually get exciting. The software is able to detect over 135 different things from a loose bracket or poor fitting aligners, even gum disease. So all of this valuable information allows me as the doctor to make real-time decisions on how to proceed with treatment rather than being in the dark until our patients physically come into the office.
So, what inspired you to introduce dental monitoring to Cruz Orthodontics?
Yeah, good question. I had a colleague on the East Coast who convinced me of its value at a time when our office was dealing with challenges of accommodating our patients' busy schedules. On top of that, I'm always looking for ways to provide the best treatment and results that I know how. Between our young patients going to school and having after school activities and our adult patients' busy work schedules, it's become more and more difficult for our patients to physically make it to our office. So, dental monitoring has been a perfect solution for us. I'm now able to provide higher quality treatment while still working with our patients' hectic schedules.
Dr. Cruz, how does dental monitoring enhance the patient experience during orthodontic treatment?
Yeah, it does so on many different levels. For one, the dental monitoring app has the ability to message me directly, and it's easy for me to check throughout the day. Our patients have become so appreciative of having their questions answered almost immediately. I mean, how often have you had questions for your doctor, but we're too busy to make a call and be put on hold for who knows how long, or have to wait days for a response? I've even had situations where I've got a question, but it's over the weekend, so it's hard to get a hold of anybody at all. So, on top of that, I can use the most recent scan to see what's the patient's concern, and then that allows me to give a detailed response. I'm also able to draw and highlight the pictures from their scan so that I can better communicate with our patients. So it's hard to overemphasize how grateful our patients are just to have direct access to me basically at all times. Another cool feature that a lot of our patients love is the app uses the scans to splice together a movie showing how the patient's teeth are moving. So it's definitely motivating for our patients just to see the progress that they're making as their teeth kind of morph and move into
I haven't
alignment.
heard that. That
It's
sounds
pretty
really
cool.
fun. A movie? We'll have to show one of those.
Yeah, yeah, it's pretty slick.
Could you walk us through how patients use dental monitoring on a day-to-day basis?
Yep, it's pretty darn easy. I have to hand it to dental monitoring because they've made the whole process really user friendly. Once a week, our patients receive a notification on their phone from the app letting them know it's time for a scan. So you don't have to remember when it's time to do it, it'll automatically ask you. The scan itself only takes a couple of minutes and you can do it from anywhere. Our teenage patients really love it because they've gamified the app, making it fun to take the scan. And that's basically it. All the heavy lifting then takes place with the detection software and me reviewing the scans to determine if any treatment decisions need to be made. And then if so, I then message the patient with instructions.
Dr. Cruz, do you have any patient success stories you can share with us?
Yeah, for sure. One of the great features for dental monitoring with our younger patients is that any communication that takes place also goes to the parent's phone. So we've had so many appreciative parents thanking me for showing their child areas that they aren't brushing well or encouraging them to wear their elastics more if there hasn't been any tooth movement. It really takes the pressure off of the parent. As a father of two, it's hard raising kids,
Mm.
and taking even a small amount of responsibility off their shoulders has been really appreciative. So, sometimes even late at night, I'll get these responses back on dental monitoring through the app where, a dad will say, "Thank you so much for encouraging my son. I'm having a really tough time doing it on my own." So it's been really helpful for taking the pressure off of parents.
Dr. Cruz, how do you see technologies like dental monitoring changing the future of orthodontics?
It ultimately comes down to two things: quality of care and safety. With dental monitoring, I can now feel oriented in a way this I never thought possible. In the past, I was constantly dealing with surprises like gum disease or poor compliance, and that would negatively impact our patient's treatment. Now there are no surprises. I'm able to track patients in real time and make decisions that allow for the best results possible. Uh, with regards to patient convenience, dental monitoring now makes it possible for nearly everyone to be a candidate for treatment, regardless of health.
So, are there any limitations that patients should be aware of when using dental monitoring?
Not really. I went into this eyes wide open, making sure that dental monitoring was easy to use for our patients and actually delivered on what its promises are. And
Mm.
so far, it's exceeded my expectations.
Do you have any advice for patients to ensure they get the most out of dental monitoring?
Yeah, that's an easy one. Dental monitoring is no help if you don't do your weekly scan. It doesn't happen often, but every once in a while we'll have a patient that doesn't do their weekly scans, and it really only takes a minute or two, and it makes such a difference with the whole treatment experience. So that's the only thing that we need to make sure of if it's done.
How does dental monitoring contribute to getting more accurate and efficient treatment outcomes?
I think the easiest way to think of it is dental monitoring keeps our patients' treatment on course. Rather than only seeing our patients every 2 months, I can now see them every week, allowing me to keep them on a very narrow treatment path. Without it, patients' treatment can really get off course, causing all sorts of problems, extended treatment time being the big one. How many times have you heard stories about the poor soul who had braces on for 5 years? That should never happen now that we have dental monitoring. Treatment will stay on track.
In what ways does dental monitoring align with the goals and values of Cruz Orthodontics?
I'd like to consider our practice one that focuses on quality care, and dental monitoring has reignited my passion for doing just that. It's been decades since something as disruptive as dental monitoring has come around. The control that I now have with regards to treatment and the appreciation that our patients are showing has made things fun and exciting. So it sort of rejuvenated, my career, and I'm having a really good time with it. And I'm just grateful that I adopted it when I did.
I'm glad you did as well. I'm sure it'll help a lot of your patients. So, thank you for being on for our second episode of the podcast. I'm looking forward to seeing you on the next one.
Thank you.